To move us forward, families with cerebral palsy and autism patients have often faced stigma with the condition, at one point entangled with myths. But the health sector fraternity has moved to demystify and debunk the myth on cerebral palsy and autism, with parents or patients coming out, with parents also coming out to openly talk about this neurodiversity condition. Current research points to a complex interaction of genetic, neurological and environmental factors acting together before and around birth. According to health experts, cerebral palsy results from damage or abnormal development of the brain before, during or shortly after birth.
National statistics from Centers for Disease Control and Prevention shows that between 2023 and May 2025, about 1 in 36 children born have autism. According to the World Health Organization, 1 in 56 children born daily have cerebral palsy. Parents have been advised to check for signs like no social smile, poor eye contact, not responding to name, no pointing or waving, loneliness and floppiness when held, among other signs.
In terms of statistics, we rely on what the WHO has projected. 1 in every 59 children are born with neurodiverse. When I say neurodiverse, it's the autism and the disabilities I've mentioned.
Some parents at some point find it hard to accept the situation.
I had to seek therapy myself. I seek therapy then so that I can accept that my child has a condition. Then we move together with his therapist, and later I embraced neurodiversity.
After finding out that you have a special child, the first thing is to accept and embrace it so that you can start the journey of raising the child.
We need to support each other. We should not run away. We should not even chase the wife or chase the family or even start another family. We just take it positively and know that is your family.
Therapy is a process that a cerebral palsy and autism child need to help in their growth and well-being.
A speech and language pathologist will be able to assist you to communicate verbally, or if not verbally, to use some signs or to use some alternative ways of communication. Also, you seek for an occupational therapist so that he can be able to assist you in integrating your senses and makes them calm down as you function well, or as this child functions well in the society or around that context. Also, you seek for a nutritionist to give you an order or a schedule of eating some foods.
Children with these conditions have a special diet and medication.
There is a specific diet. They're supposed to be gluten-free, casein-free, and it depends with the nutritionist or the level of the condition of your child. But you are supposed to be on a wheat-free diet.
The government introduced policies to support inclusive education, such as the Special Needs Education Policy Framework in 2009, and was revised in 2018, which aimed to provide equal opportunities for all learners.
Engaging therapists at the school level is a bit of a challenge for these public schools, because you see now that is an extra cost to the school. And some parents, in as much as they would resource mobilize and have the therapist coming there, sometimes it's a burden.
Kenya has made progress in promoting inclusive education, with private and public schools coming in to provide assistive devices and infrastructure.
A lot of emphasis has been given to the age-based pathway of education, but the stage-based, where now the children that are needing special attention is concerned, it has been left behind. Schools have not been empowered, and therefore this particular pathway is not even existent in many schools.
Despite these efforts, challenges remain, including inadequate funding, lack of trained special need teachers and professional therapists, among other challenges.
Challenges of the beddings in the dormitories, our infrastructure, that is the classrooms are not adequate enough to accommodate these learners. We also have challenges of the boarding itself, like the foods that we need to feed these children with. We don't have much.
Speech therapists in Kenya are very few. I think there are less than 20. At least within the occupational therapists, they're also not quite enough, because you see these are government officers or the clinicians coming now to the school and having not being at the hospital level.
Education stakeholders argue that inclusive education remains a work in progress, but still requires sustained efforts and resources.